Welcome to the Care Management Follow-Up Visit. In previous videos, we covered how our care management programs work, the onboarding process, consent, and how our dedicated team supports residents with chronic conditions. In this session, we will focus specifically on the follow-up visit, when it is needed, and exactly how to complete it in ROFE.
Here is how these visits fit into our overall care management process. Our care coordinators perform monthly chart reviews to identify care gaps, things like missing vaccines, labs, assessments, or other medical necessities. They send a monthly report to the facility so the team there can address the gaps. If the same care gap remains unresolved for more than 3 months, that is, 90 days or longer, and the facility has been unable to address it, we schedule a telehealth follow-up visit with one of our providers. This is our safety net to make sure the resident gets the care they need.
These follow-up visits appear in your ROFE schedule labeled as follow-up visits. You access them exactly the same way you have accessed other care management visits.
Start by going to https://rofe.medilitegrp.com/. Click on Calendar to see a full view of your assigned patients. Each patient box clearly shows the specific visit type. This time, it will say Follow-up Visit.
Click the patient box to enter the individual follow-up visit record. You will immediately see the patient's name, date of birth, and BIMS score.
If you need more context, simply scroll to the right within the patient record. This reveals the visit status and any additional information you need to be fully prepared before the visit begins.
Once inside the template, you will notice several important differences from the onboarding visit. The type of visit is listed as subsequent. The template comes pre-filled with the specific care gap information that needs to be addressed.
Look at the Chief Complaints section. It will already state that the patient was seen and evaluated. The History of Present Illness, or HPI, will clearly show the specific care gap that needs to be resolved.
There is no consent section in this template. Consent was already obtained during onboarding.
Your main job during this visit is to address the care gap through your assessment and plan. Review the pre-filled information, speak with the resident, and document clear steps in the plan section to resolve the gap. Mark any needed changes directly in the template.
Once the care gap is addressed and documented, complete and sign the visit as you normally would. This helps close the gap and improves the resident's overall care.
This completes the care management follow-up visit training. You now understand exactly why these visits are scheduled, how the care coordinators and providers work together to close persistent care gaps, and precisely how to use the pre-filled template in ROFE.